Good evening. I'm Dr. Meti, urologist. This evening, I want us to discuss one important topic, which is a trending topic, I believe, because it does come to my desk every now and then. Penile shortening. Yes, penile shortening. Is it a real problem or just a myth? How does it occur? What's your experience from wherever you are listening to me across the world? You have patients coming to your end complaining that after being exposed to some form of sexually transmitted infection, especially gonorrhea or syphilis, whatever, the patients subsequently come down with shortening of the penis. And this fact has been drummed home from way back on radio, television. We have a lot of herbal medical practitioners drumming home that point. I think it's a way of selling the drugs. It's a marketing strategy. But is it a myth or it's a fact? The discussion has been making rounds among urologists. Yes, we discuss amongst ourselves that, oh, it's not true. It's just a marketing gimmick. And patients shouldn't give it any credit. However, every now and then, this issue will come to you, young and old, will come to you to the consultant complaining about shortening of their penis after contracting sexually transmitted infection of a sort. We go through literature. Some of the listed possible causes of penile shortening are age, obesity, radical prostatectomy, some medications, especially finasteride. Circumcision has been listed as a possible cause of penile shortening. Smoking and then also penile webs are listed as possible causes of penile shortening. Sexually transmitted infection doesn't come up as a possible cause of penile shortening. And I've had to explain to a lot of patients coming to me that there is no established literature that supports such an assertion that sexually transmitted infection can lead to shortening of the penis. It can take you as long as 45 minutes just trying to educate the anxious gentleman or elderly man in front of you. I can understand how the other listed causes can cause some loss of penile length. In fact, I have seen a patient lose some penile length after some difficult urethroplasty. And it wasn't a single stage urethroplasty. It was after multiple surgeries had been done. And it was because, of course, in those surgeries, some flap wasn't used to restore length of the urethra. But let's leave that aside for now. Some of the listed causes, age is listed as one of the possible causes of loss of penile length. How does it come about? It's possible it's due to atherosclerosis of the common penile arteries. Because the common penile arteries, that's branches to form the cavernosal arteries, bulbourethral arteries. The cavernosal arteries are the main arteries that bring blood to engorge the erectile apparatus, the main erectile apparatus called the corpora cavernosa. For penis to become engorged with blood, assume skeletal rigidity, and have penetration hardness. It must engorge with blood. And if the blood vessels become occluded progressively by atheromatous plaques, some of which are as a result of aging, others due to diabetes, as well as hypertension and dyslipidemia, it can lead to a significant reduction in the blood coming to the penis. And over time, because the human body loses some amount of form as a result of reduction in either blood supply or nerve stimulus, we can assume by extension that over time, maybe due to less stimulation of the penis as a result of decreased blood flow to the penis, it may lose some length. Just saying. Just saying. Now, weight does not really cause an actual loss in length. It's more of an apparent loss. What do I mean by this? Morbid obesity can lead to deposition of excess fat at the mons pubis. The mons pubis is that region just above the penis, which can accumulate with redundant amount of fat. In fact, accumulation of fat around the thighs and around the mons pubis can cause some form of retraction of the penis. And this can create an apparent loss in length. And I say apparent because if you mobilize the fat backwards, or if the patient loses fat, loses weight, then normal length of the penis is seen to be restored. And so, excessive weight gain can lead to some apparent loss of penile length. Not that the penis has lost its actual length, but just because it is buried in fat. So I hope that makes sense over there. Now, radical prostatectomy is also known to cause loss of penile length. And this is beautifully illustrated, explained in one article by Anders Frey et al., which was published in 2014 in PubMed. And in that article, they state that about 15 to 68% of patients who undergo radical prostatectomy experience some penile shortening. And about 60% of these patients have their normal penile length restored over 12 months. And that is even why patients who go through radical prostatectomy as part of recovery also are advised to go through penile rehabilitation, which involves administration of PDE5 inhibitors like tadalafil. And what this seeks to do is to help with the vasodilatation so that the penis gets engorged with blood vessels. And then through penile rehabilitation like massages, loss of length is avoided. Radical prostatectomy causes injury to blood vessels that supply the penis, as well as to the nerves. Then some of the neurovascular bundles, some may even be sacrificed, or some are compressed by hematoma. And so recovery of the vessels and the nerves takes time. And like I alluded earlier, once you have a reduction in either blood flow to the penis or there is some form of neuropathy or neuropraxia, it can lead to penile shortening. So that is how that particular phenomenon can be explained. And this is found in an article published in PubMed, like I said, in 2014 by Anders Frey et al. The title of the article is Neglected Side Effects After Radical Prostatectomy. Right. Now, Peyronie's disease is an idiopathic thickening of the deep fascia of the penis. Peyronie's disease is quoted as one of the causes of penile shortening. Some people, for unknown reasons, the deep fascia of the penis gets thickened abnormally. There's an exuberant deposition of connective tissue in the deep fascia of the penis. This can lead to the penis bending downwards, sideways, or even dorsally. And it can cause painful erection, leading to interpersonal consequences, especially during sex. So Peyronie's disease is a possible cause of penile shortening because the penis, the corporal chambers, corporal bodies is encased in the tough connective tissue called fascia. And this fascia, when it is thickened, can lead to shortening, leading to penile shortening. And so that is a possible cause. So far, we haven't mentioned anything concerning sexual transmitted infection as a possible cause of penile shortening. Smoking is also mentioned as a possible cause of penile shortening. And like I explained earlier on, penile anatomy and function very much depends on blood, interblood vessels, good blood, healthy blood vessels, as well as adequately functioning nerves. And smoking, we know, damages the intima of blood vessels. It is one of the notorious causes of peripheral arterial disease. And even though blood vessels of the penis are, let's say, medium vessels, they can be damaged by smoking. So once the walls of the vessel becomes hardened progressively over time, it can lead to reduction in blood flow. And that can potentially lead to atrophy of the erectile apparatus of the penis, leading to penile shortening. Medications such as finasteride, which is a 5-alpha reductase inhibitor, a drug which is widely used in management of benign prostatic enlargement, has the potential of causing penile shortening. We know that the penis has receptors for the active form of testosterone, dihydrotestosterone. And finasteride inhibits the conversion of testosterone to dihydrotestosterone. So it's very possible that since the receptors of dihydrotestosterone is found on the penis and penile function also depends on lifelong presence of dihydrotestosterone to stimulate these receptors to support its function. If we reduce the circulating levels of dihydrotestosterone by administration of finasteride, then it's very possible to cause penile shortening, and that has become one of the listed possible causes. Circumcision is listed as a possible cause of penile shortening, and this occurs if excess foreskin is removed, after which the remaining skin is sutured. So during healing, scar formation can cause the penis to shrink in length. So it's listed as one of the possible causes of penile shortening. Another possible cause of penile shortening are penile webs. This is where redundant foreskin, which is inadvertently left during circumcision, can lead to bending of the penis either inferiorly or, as the case may be, dorsally. It doesn't really cause penile shortening, but it causes it to um, become entrapped in redundant tissue. And this can have also result in painful erection for some patients. But it's surgically amenable, and releasing or redoing the circumcision and releasing those entangling webs can lead to restoration of normal penile length. Penile cancer can lead to auto amputation of the penis, and that can lead to penile shortening. Surgery for penile cancer, especially the radical forms, which requires amputation of either a part, so the distal part or even the whole of the penis, can lead to penile shortening. So that's one is an established cause. But for penile shortening as a result of sexually transmitted infection, the literature is silent on it because there is no fact. Do we need to research on this? Probably, just to debunk it or otherwise. I looked in local articles, foreign articles, articles from the sub-region. I didn't come across any work blaming penile shortening on sexually transmitted infection. But it's still out there, and we still talk about this. So, just to clear the air, I think we need to do some work on this. We'll have to design some proper study. Men who have been exposed to sexually transmitted infection, and I wonder if they will be honest with themselves and state the true length of their penis before contracting the infection. And then the length they claim to have lost, whether during or after, so that we can compare to the normal cohorts and see. I'm just thinking aloud, just so we can put this issue to bed. But until then, I think it's a source of unnecessary anxiety amongst young men because they come to the consulting room guzzling tons and tons of medication with the intention to restore length, and they want us to validate the medication that they are on as being helpful or otherwise, and even write maybe alternatives to help in the restoration of length. I suspiciously think that some of these guys who come around really know that probably they were not so gifted right from birth and what they have is what they've been carrying along all their lives. But this symptom complex of having anything that happened to you after sexually transmitted infection blamable on the sexually transmitted infection possibly is what's driving them nuts. Because you have men, anytime they develop sexually transmitted infection, they catch a flu here, they have a low back pain there. Whatever happens to them subsequently, they go nuts and blame it on the sexually transmitted infection. So I have a feeling that probably is the anxiety complex they develop after sexually transmitted infection. And somehow this information has made its way to the herbal medical practitioners. I'm not here to call names, but it's common knowledge. And as a country, and especially the Urology Association of this country, I think we need to come out forcefully and make a statement to clear this matter once and for all and put it to bed. And I hope that will help to settle this matter. All right. In my next video, I'll talk about another dramatic issue concerning the penis. This one was about penile shortening. The next video, we will talk about vanishing penis. Yes, is it possible for the penis to vanish just by somebody shaking your hand or touching you casually? Whatever. It has led to loss of lives. People have been lynched, people have been beaten, people have committed suicide, people have been jailed, people have been fined as a result of this. So stay tuned for that video, and I hope we will have an interesting discussion. Like and subscribe, and let me know your opinion about what we discussed this evening. Good evening.